Thank you, Michael. I really want to thank Michael for liberating me from my own planned comments, because Michael said it much more eloquently than I could ever do in terms of expressing gratitude to the people that we need to express gratitude to. This has been a joy for us at the Peterson Center. And I'm speaking on behalf of Pete and Michael Peterson, Peter G. Peterson Foundation, and within the Peter G. Peterson Foundation, the Peterson Center on Healthcare, where Emily and I live. And Michael, the National Academy of Medicine is just terrific to work with. You and Katie and Maria have just been so welcoming and so inclusive and so planful, and you execute so well. So thank you so much for what you've done. So I want to go back a couple of years, and don't worry, I'm not going to spend 2 years telling you about the last 2 years, hopefully. And we at the center, and we hadn't even announced to the world that there was a Peterson Center on Healthcare at this point. And as it is for the foundations, as Bruce and David know, you get proposals. And you look at the proposals, and one of the great fears that I had, being new to philanthropy, I had come from the Institute for Healthcare Improvement, and I'd been in the field as a hospital administrator for my entire career, was to use the benefactors' money for something that had already been done. To use the benefactors' funds for something that would never really get into the field and make a difference. And I had a great fear about all that. And yet, our reason for existence is to fund well thought out and executable proposals. And what I found from the Bipartisan Center, from the Harvard School of Public Health, and from the National Academy, then the IOM, there seemed to be some overlap related to this population of people in our country that needed to get better care than they were getting. And so I had an idea, and I said to Michael last night, it was probably good that I was as naive as I was, and probably still am, about how maybe we could connect some dots. And I thought these three proposals could somehow be connected. Ashish wanted to look at dual eligibles, really do some what I'll call heavy analytics. The National Academies wanted to see what's out there, what's working. And the Bipartisan Policy Center said, you know, there's this labyrinth of regulation and policies with regard to this high-need population, and we really want to get into that. So my fear was that when we brought these three organizations together in one room, there would be a competition. It would be combative. And I have to tell you, it wasn't at all. The spirit that these three organizations brought to each other was wonderful. And I want to thank the leadership of these three organizations for that work and for that spirit, for that collaboration. And along the way, as I was learning about philanthropy, I had the great opportunity to talk to people like David and Bruce and others about how perhaps our foundations could build a movement, could build something greater than the sum of our individual parts. And through their leadership, we were able to develop what is now a 5-foundation effort. We all have our same identities. We all have our same little piece of that change management process, but we're linking arms. So it's been a wonderful, wonderful process. I want to thank, excuse me, Peter. Michael already has, and we'll probably have to get him up here soon because he's kind of being crushed by the weight of the compliments, but they're well deserved. You know, when you take on a voluntary effort, you can lean in and get fully immersed and wonder what you're going to do about your day job. or you can step back and say, well, I'll do just what I can. I don't know about your day job, Peter, but you leaned in and have done just a terrific, terrific work, and we're here today because of it. The last thing that I want to say is a true sense of gratitude to Eric, Veronica, and Gretchen. You bring the reality of what we're trying to understand into this room. And I thank you for that. And my hope is that you feel fully embraced, not only by me, but by the entire room, because you are the inspiration for us to really take this outside the room. And that's what the Peterson Center, and I think all philanthropy, the 5 foundations, is about. How can we have an impact out there for the people who deserve better? So Peter, I'll ask you to come up. Thank you very much.